What is diabetes mellitus? Diabetes mellitus is a chronic metabolic disease involving inappropriately elevated blood glucose levels. It is characterized by high levels of glucose in the blood due to problems with insulin production or function. Diabetes mellitus has several categories, including type 1, type 2, gestational diabetes, neonatal diabetes, and secondary causes due to endocrinopathies, steroid use, etc. Type 1 diabetes is an autoimmune condition in which the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. Without insulin, the body cannot regulate blood sugar levels effectively. People with type 1 diabetes must rely on lifelong insulin replacement therapy, such as multiple daily injections, an insulin pump, or an automated insulin delivery system. If left untreated, type 1 diabetes can lead to diabetic ketoacidosis, DKA, which is life-threatening. Type 2 diabetes mellitus is a chronic condition characterized by insulin resistance and relative insulin deficiency. This means that the body's cells do not respond effectively to insulin, and the pancreas does not produce enough insulin to maintain normal blood glucose levels. About 90 to 95% of all people with diabetes have this type. The diabetes mellitus codes are combination codes that include the type of diabetes mellitus, the body system affected, and the complications affecting that body system. As many codes within a particular category as are necessary to describe all of the complications of the disease may be used. They should be sequenced based on the reason for a particular encounter. Assign as many codes from categories E08 to E13 as needed to identify all of the associated conditions that the patient has. The age of a patient is not the sole determining factor, though most type 1 diabetics develop the condition before reaching puberty. For this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes. If the type of diabetes mellitus is not documented in the medical record, the default is E11, type 2 diabetes mellitus. If the documentation in a medical record does not indicate the type of diabetes, but does indicate that the patient uses insulin, code E11, type 2 diabetes mellitus, should be assigned. Additional code should be assigned from category Z79 to identify the long-term use of insulin, oral hypoglycemic drugs, or injectable non-insulin anti-diabetic. If the patient is treated with both oral hypoglycemic drugs and insulin, both code Z79.4, long-term use of insulin, and code Z79.84, long-term use of oral hypoglycemic drugs, should be assigned. If the patient is treated with both insulin and an injectable non-insulin anti-diabetic drug, assign codes Z79.4, long-term use of insulin, and Z79.85, long-term use of injectable non-insulin anti-diabetic drugs. If the patient is treated with both oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, assign codes Z79.84, long-term use of oral hypoglycemic drugs, and Z79.85, long-term use of injectable non-insulin anti-diabetic drugs. Code Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient's blood sugar under control during an encounter. An underdose of insulin due to an insulin pump failure should be assigned to a code from subcategory T85.6, mechanical complication of other specified internal and external prosthetic devices, implants and grafts, that specifies the type of pump malfunction as the principal or first listed code, followed by code T38.3x6, underdosing of insulin and oral hypoglycemic drugs. Additional codes for the type of diabetes mellitus and any associated complications due to the underdosing should also be assigned. Overdose of insulin due to insulin pump failure. The principal or first listed code for an encounter due to an insulin pump malfunction, resulting in an overdose of insulin, should also be T85.6, mechanical complication of other specified internal and external prosthetic devices, implants and grafts, followed by code T38.3x1, poisoning by insulin and oral hypoglycemic drugs, accidental, unintentional, secondary diabetes mellitus due to pancreatectomy. For post-pancreatectomy diabetes mellitus, lack of insulin due to the surgical removal of all or part of the pancreas. Assign code E89.1, post-procedural hyperinsulinemia. Assign a code from category E13 as the principal or first listed diagnosis, and a code from subcategory Z90.41, acquired absence of pancreas, as an additional code.